Hi, I'm Dr. Bonnie, a board-certified pediatrician and a pediatric critical care doctor. And in this YouTube channel, I talk about different medical topics related to both pediatrics as well as health topics. So today, I'm just going to make a brief talk about constipation. It is a very common problem in both children and as well as adults. Most of the time, it's a simple problem that can be fixed and helped by the pediatrician. However, sometimes if constipation is severe or if there is some kind of structural problem or anatomic problem going on, your child should be seen by a pediatric gastroenterologist and sometimes even a pediatric surgeon for things like Hirschsprung's disease, which is like something to do with the motility of the bowel or any kind of anorectal malformation. So if there's any kind of structural defect which is leading to the constipation. However, I'm just going to talk about the simple constipation which we encounter in most kids. And so the definition of constipation is typically if you're having less than 3 bowel movements a week, or if you're straining to have a bowel movement about 25% of the time, and the stools are coming out as very hard and lumpy most of the time. And a clue to that would be if your child's stool is clogging up the toilet. So if you give me the history that once in a while, every week you're having to use the plunger because the bathroom is getting clogged, that is a clue that your child actually has constipation. Because a lot of times when you ask parents, is your child constipated? The answer is no. Because honestly, who really, goes and looks at the stool? Or like, when do we really ask our kids if they're older, like if it's an 8-year-old or a 9-year-old, who's really asking them every day, like, well, how was your stool? Or how many times did you go, right? So a lot of times constipation in this age group can be missed. So that's a clue. So if you're having to plunge the toilet fairly frequently, your child could be constipated. And then another way the stools present is if it's really hard, pebbly stools, kind of like a rabbit stool, that's another sign of constipation. And then another one which people don't think about is soiling of the underwear in a child that is already toilet trained. And so that is actually called encopresis. And what is encopresis is if the poop is so hard and so backed up, so if you have really bad constipation and there is large lumps of stool sitting inside the colon, you actually have liquid stool coming out around that hard stool. So you have liquid stool backing up and coming down around that hard stool, and it comes out like a involuntary. So it's like an incontinence, and it soils the underpant and sometimes can present as diarrhea. So I actually had seen a patient a long time ago with this, where the initial complaint was, my child is having diarrhea. So I approached it as like a normal gastroenteritis, and I was talking about hydration and maintaining hydration and things like that. But then I started digging a little bit deeper into the history, and finally it came out that the child actually did not present with diarrhea. This was actually encopresis. The child had actually had chronic constipation because of poor diet and other things. However, now the constipation had progressed to the point where he actually was having encopresis, where he was having this liquid stool and having accidents. And this child was around, I think, 6 or 7, and he was having accidents at school almost on a daily basis. And that can actually be very difficult for a child at that age to be having this kind of accidents at school. So that's another thing to keep in mind, is if your child is presenting with diarrhea, is it really diarrhea, or is it constipation masquerading as diarrhea? So encopresis is an important point that also gives us a clue as to if constipation is present or not. So how do we manage it? So treatment in simple constipation, it's majority of the times the pediatrician would manage with dietary measures. So improving the diet, focus on the diet. Is your child getting enough fiber? So things like ways to improve fiber would be doing things like whole grains, so brown bread, brown rice, things which have more fiber in it, and less processed food, because that adds to the bulk in the stool. So improve the fiber in every way you can. You can increase fruits, vegetables, and also drinking more water, because that's going to also prevent that hard stool. So dietary measures would probably be the greatest effect on simple constipation. And then your doctor may also prescribe things like, laxatives, stool softeners, things like Miralax, which are fiber supplement. And in the beginning, that in conjunction with the diet would probably be helpful, because we have to get a handle on the situation until the diet kicks in and things can get better. So diet along with these supplements, dietary fiber supplements, etc., would be helpful. And then the third one would be if the x-ray has been done and there is a big hard lump sitting in the rectum, at that point giving the laxatives is actually bad, because if there is basically an obstruction with that big lump of stool, giving a laxative is just going to cause vomiting and cramping, because the colon is going to try to pump against that, and what's going to happen is not going to be able to push it out, and so it's going to lead to more stomach pain and vomiting. So if you notice that there is a big hard lump, actually should be treated first with clean, what we call from down below. So give an enema, give an enema to get it cleaned out, and then can put in those other measures like diet and laxatives and stool softeners. So an enema, especially in the hospital when we see kids coming in with bad, impacted stuff like that, cleaning out is good option with an enema, or sometimes even we used to go lightly before, where you just clean out everything. So those are the simple things that are done for constipation. It's a very common problem, and sometimes is missed because people don't take that history. But so some clues would be if the toilet is getting clogged, or if there is soiling of the underwear. So when you're doing laundry and you see your kids' underpants are stained with poop, that might be a time to question, like, what exactly is going on? Like, is there constipation that is being untreated? And toilet training, in younger kids, sometimes it happens, it starts very young, like when they're toilet training and they're not going to the bathroom, and their constipation can be a vicious cycle. So, what happens is the child is not going to the bathroom on time, is going a little bit at a time, and they are holding that stool. And so that stool, as it is staying inside, is getting harder and harder, more water is getting absorbed. So that stool is getting harder and bigger. And so that is actually leading to the rectum and the sigmoid getting dilated. So the colon is getting stretched because there's this big massive stool sitting in there, right? So it's getting stretched, and that leads to more constipation, because when it's stretched like that, the movement cannot happen well. So peristalsis, or the movement of the intestine, that sort of get disrupted. So then that mass is just going to sit there and not come out normal, and then that leads to more constipation. So this constipation is really a bad thing. It can be a very vicious cycle, and then it's hard stool getting stuck, more hard stool, to the point where now you're impacted. And another complication of constipation is actually the fissures, and that is a really bad thing, because once the fissure happen, the anal fissures, which is a tear down below because of a hard stool, it can cause really bad pain when going to the bathroom. So if the kid is trying to have a bowel movement, it can be extremely painful because of the fissure. And because of that, they are going to hold the stool some more, because it's painful experience to go to the bathroom. So then they are holding their stool, and that ends up becoming more of more constipation, and so on and so forth. So we have to break this cycle, make the stool soft so it's easy to go to the bathroom, so that we are no longer holding it in. And then if we need to clean out from below, we need to clean out. But again, go talk to your doctor, change the diet when, start that. At least you can do that on your own. And then if it is really bad, may need to go see a pediatric gastroenterologist. So I hope this video helps clear up some facts about constipation. Follow me and subscribe to my channel for more such videos. I'm a board certified pediatrician and a pediatric critical care doctor, and I've been practicing in California and practicing medicine for a long time. So I hope this helps. Please put in your comments if you had any experience with constipation, or if your child had constipation. What have you done that has helped? I would love to hear from you. Thank you.